Today's topic is not root canal treatment, no caries, but something very close to my heart because a cousin that is, I love her. Janet is her name, it can be any name. However, the syndrome is called Sjögren syndrome. This is a syndrome that very few people know about it. As a dentist, I have to study that. However, some patients don't understand what is this, why their tongue look like this. And when you realize that the patient is suffering, they feel like the tongue is burning. My cousin said that I cannot eat anything. Everything hurts. It's very hard for me to taste and to talk, to feel, because the mouth gets so extremely dry that there's not even a way that you can even move your lips. And what is this syndrome? This syndrome happens when the immune system all of a sudden attacks the glands and make a moisture in the eyes, first of all, mouth and other parts of the body, including for us women, the genital area in a human and in a woman. That area is gonna create also dryness. The skin gets very dry for the patients everywhere on the body. And I'm not gonna talk about the whole body because I am a dentist and an endodontist. And I wanted to make you aware that this syndrome exists and why your mouth gets too dry. Most people with this Sjögren syndrome is women. And the woman happen, guess what? At 40 age or 50, sometimes it's postmenopause, but also can happen before. You don't know when it's gonna come. And this is the most interesting part for me. It doesn't matter the color of our skin, what is the race, what is your ethnic background. We at some point can feel as women the syndrome. And what is the cause? Well, they believe it's a genetic and environmental factors that are involved. The studies have linked this Sjögren syndrome to very different variants in several genes, many of which involve immunity. We were reading about it and studying in different articles. They have linked arthritis, mostly like rheumatic arthritic problems in patients that are linked exactly with the syndrome. And I'm sure the gene is already found. However, very few people know how to do. And the way they studied, my cousin was telling me, you go first, I get so dry that you go first to the ophthalmologist and they're gonna do a test in your eyes and they check the amount of saliva, of the irrigation, your tears, etc. How dry is your hair? So you're gonna have your dry mouth. Sometimes it starts with the eyes, and of course you have very difficulties to eat dry food. Your whole life changes, loss of sense of taste. Sometimes your saliva is so thick that you see these people with white saliva outside or non-saliva at all. But this is important. The patients can have so much decay. They're very prone to have decay. And for that, I talk about in another episodes of the Canberra protocol, where now we recommend in one of the areas, listen to this, for these type of patients that are very prone to decay, you have to put a teaspoon of Clorox from the market, and then fill the glass of water, 8 ounces of water, and they have to do for 1 week rinses with this Clorox diluted in an 8-ounce glass with a little teaspoon of Clorox. And then you do the rinses, and that is gonna avoid to having all these bacteria. Now, what are other treatments for the avoiding caries? Like you become caries like we have it in the model here, and then root canals. You can use the rinses every month, the Clorox, the way I told you. And also we have to find saliva production stimulators that I don't know I'm sure in every area in Latin America, Spain, they have different products. I'm not advertising because I don't work for any of these companies. There's different companies act the pharmacies in the United States, CVS, they all have their own brand where it says dry mouth. And you go, my cousin tells me that this one for her has been the most comfortable because it lasts longer. You can have more saliva. The Biothin, the toothpaste that she uses all the time, she loves it. We have a rinse of Biothin also, it's a mouth rinse. And we have a spray that you can carry the spray in your purse, and now they have little sprays, little bottles of spray with different, the brand doesn't matter. It just matters that it says for dry mouth syndrome. You can try them because the tastes are different. And also a new company came to offer me the, like the oils for aromatherapy. So now they use different mint oils to dilute it in water also to help you to lubricate your mouth. So I hope you are clear about this syndrome, that this syndrome is dry mouth syndrome, but it's due to the Sjögren syndrome, and very few people know it can be linked to menopause or arthritis. But if you suffer of that, go to see your ophthalmologist first. They're gonna do a testing, they're gonna check your saliva too. And also you can talk as a woman to the gynecologist, and a mom to whatever doctor they're gonna see, and find out if they have dryness, what kind of lubricants they can use to feel better and have a better lifestyle. I hope you like this topic. Once you use all this treatment for this type of mouth, yep, you as a patient gonna have a better life. If you have any questions, just don't forget to call us too. Send us a message to our YouTube channel, Dr. Fanny Yacaman, and to Instagram and to TikTok. Thank you very much. Bye.